We're just starting to see kind of upticks a little bit in COVID and not yet in influenza. So now is the opportune time to get both those vaccines. RSV season tends to run with influenza and COVID, so they tend to be in Minnesota our cold month viruses. RSV typically has a significant impact on the pediatric population. Just about a year now, we have a vaccine that we can give for our older patients as well. So usually 60 and older with comorbidities, meaning you have other illnesses, so lung disease, heart disease, immunocompromised, folks living in a nursing home or retirement home. The flu season varies a little bit in its length, and we want to try to get those shots early enough in the season that you're immune by the time we start seeing cases start to increase, but kind of late enough in the season that it actually lasts the length of the season itself. Usually starting late October, early November, we start to see increases in those numbers, and so we often recommend that folks start getting their immunizations kind of prior to that. We'd like folks to be immune when we start seeing significant increases in those circulating viruses. Certainly if you have an appointment for anything with your primary care doc, whether it's a toenail removal or a wart or what have you, you can get your shot when you come in for that stuff as well, and we encourage you to do so. And we'll be asking you if you want your shots, irrespective of why you're coming in. Vaccination is going to be the most significant and important way to help prevent these diseases. None of these vaccines, unfortunately, prevent the disease 100%. They decrease the severity, they decrease the risk of somebody having an infection, and then by doing that, if we get enough people to do that, it also decreases the circulating viruses as well. There's still quite a few people who in our population, for whatever reason, are concerned or worried about getting vaccines and worried about the harm about vaccines. As a parent and as a physician, I'm comfortable with the safety of it, but I understand that people are not always comfortable with it, and also understand that the reason that they worry about it is because they care about themselves and they care about their loved ones, and they want to do what's best for them. And so I would encourage folks to, if you find yourself in that group or having questions, have conversations. We're people too. We have fears. We have concerns, and having an open conversation about it. Right. We know your health is important to you as a patient, and so we're a resource that we should be able to have a conversation in a very non-judgmental way and tell you about how we look at the data and how we treat our families, and answer any questions that you have.